Okay, so go ahead and record. Okay. So again, good afternoon, welcome. This is a workshop on advanced searching in PubMed and how to use your advanced searching skills that we'll talk about in this workshop to improve your research skills. I think this is a really, really valuable but often overlooked piece of research where it's almost like trying to learn to speak a different language with different databases, and every database has a different language. So it can get really tricky. But when you know certain tricks and tips and ways to format what you're typically used to searching with, it makes things a lot easier for you and a lot more relevant results come up for you as well. Okay, so first, hi, that's me. I am the School of Health Professions librarian. My name is Damiana Fortenberry. So if you get that wrong, if you ever need to talk to me in person, that's okay. Or if you call out just Miss D or Miss F or whatever else, during the workshop, if you have a question, let me know. This is our library website with our catalog. You can call us or you can just email me directly, whatever you're comfortable with to talk about. We can talk about PubMed or really any database. And I'm happy to talk about it. Okay, so some of the things I want to talk about, I wanted to include this idea of formulating your question or research question in Pico first, to give some clarity and organization to the search. Pico really is mostly used to make sure that all the key concepts of your research are being covered in the search that we're doing in PubMed. Constructing a search is the next part, and that will include like where to find mesh terms and what are mesh terms, keywords and where to find those, and then how to kind of put those together along in the right format, along with your Boolean operators, and then refining it. So when you put them together using like nesting, making sure that everything is kind of clean and put together nicely so that the search is as optimal as it can be. And then we're going to talk about what automatic term mapping is in PubMed and field tags as well, to kind of really kind of refine and tease out those concepts that you really want to see in your search. Okay, so for this particular demonstration, I have this question. Does daily aspirin intake reduce the risk of heart attacks in adults over 50 with no prior history of any cardiovascular disease? So that's a pretty great question, but we want to put that in the Pico format just to make sure that we're covering the really important aspects of it. Because you could go through and try to kind of highlight or underline the words that you think are the most important, which are the words you'd want to include in the search. But Pico is a more systematic way to do that, to go through and make sure that it's really all covered. I don't know how many people are familiar with Pico, but Pico stands for population, intervention, comparison, outcome, and time. If that is indicated, often it is not, but it does exist there as a part of the question if needed. So in our question, for example, we had our population, which was specifically adults over 50 years old with no history of any cardiovascular disease. We had our intervention, which was daily aspirin intake. So something to look at. Their comparison that we are trying to compare this intervention to is no aspirin intake. And then our outcome, what is the outcome we're trying to look for with this particular population, with this intervention and its comparison? And we're trying to look at the heart attack rates between the aspirin group and the control group. There was no time indicated in our question, so we're not trying to look at, how often they were taking, like how long they were taking the daily aspirin. So, the question might have said, is there, an increase of heart attack with the no aspirin intake versus the daily aspirin intake over the course of a year? that would be a time element to include, but we didn't have that, so we don't need to include that in search. Okay, so now we need to identify the mesh terms and keywords. Mesh term stands for medical subject heading. It's controlled vocabulary for indexing articles in PubMed. Really, it's kind of like a way for doctors and researchers to make sure that when they're talking about something, they're talking about the same thing, despite the fact that it might be called different things in different locations. In England, they might call, a procedure one thing, and in the US, they call that same exact procedure something totally different. So this is just PubMed's way of saying, like, an article from England where they call it this, and an article from the US where they call it something totally different are going to be indexed under the exact same term. And we've all agreed on this particular definition. So that's just a way to help keep everything organized. And it's a very helpful systematic method. There are always things being added to mesh. There are sometimes problems with it, but for the most part, we want to include it in a search to make sure that it is comprehensive, as comprehensive as we can make it. And keywords are kind of like, if mesh is a dictionary term, keywords are like the Urban Dictionary. They are more plain language. They're not going to be very, well, they can be very professional, but they're going to be kind of like common language you use in a conversation to talk about something medical. And a combination of both these layman's terms as well as mesh is what makes your search more comprehensive, which is a good thing. Okay, so now I'm going to show you where to find these things, because it's all well and good to want them included in your search, but now we need to talk about where to actually go to get those. So I am going to bring up UAD libraries. I'm going to try to get there from the, well, I'm going to get there from the home page so you guys can just see really quickly how to do that. So this is the library homepage. And we'll go to databases. And PubMed is here on this right-hand side under the most frequently used. Most frequently used because it is very, very popular for good reason. Okay, so this is the homepage of PubMed. When you're trying to find mesh terms that are relevant to your concept or your research question, first you want to try to find your mesh terms. You'll go down to this little globe with a mouse under Explore and go to the mesh database. And the mesh database is like a totally different collection of, it's just a collection of mesh terms. You get there through PubMed, but this search bar, this won't be searching articles. This will just be searching for mesh terms. So in our example, we had, okay, so we had adults over 50 with no cardiovascular disease. So I'm going to look for adults. I could also maybe look for healthy adults if I wanted to try and see. That's one of the things about finding mesh terms that are applicable to your concept. Sometimes it's not obvious what mesh terms are going to be best. So I looked up adults, but maybe there would have been like a healthy adult. There's not, but I don't know that off the top of my head. I don't know until I go looking. So I do see adults though, and it defines it between the ages of 19 and 44 years of age. So maybe that's not the best one, because we're looking at adults over 50. So maybe we look at this mesh term tree, and this is where adults is placed under age groups, which makes perfect sense. But I wonder if this aged one is more appropriate. A person 65 years of age or older, not quite. But maybe I don't need this particular mesh term if it doesn't apply at all. If there's only adult or aged and neither of these things apply, you don't have to use it. It's just, if it's not going to work out, that's fine. But I also see this middle-aged. Aha. Aged between 45 and 64 years. Perfect. So because I just found this by looking through the mesh tree terms, I'm going to decide that this is the best one for the category, the concept that I'm looking at, which is adults over 50. And then I'm going to click this add to search builder. And I do that because it puts it in this format, right? So it's got quotations around middle-aged and square brackets, it says mesh. This is important. This formatting is what allows PubMed to actually read what you're trying to say, if that makes sense. I hope that makes sense. I will copy this, and often I will put it in a Word document, which allow me to bring one up right this moment. So I will often put my concepts in a Word document. So I'm looking at adults over 50 who are otherwise healthy, which I can't find the exact mesh for that, but I'm going to try again. So adults over 50, that is the perfect mesh term for that concept. So I'm going to paste it right under there. Then I'm going to go back to this, and now we have to find keywords. So we found this perfect age group, this mesh term for this particular age group. I wonder if I could find healthy adults or healthy middle-aged. There's no terms, so that's fine. What else could we use? So usually, let me see. Okay, so keywords often, I can find this pretty easily under entry terms. You could also just go to Google, or you could just kind of brainstorm on your own or with a partner to see about how you talk about this group of people. So this one said, you know, the official mesh term is aged, but they also say that people talk about this particular group of people under mesh, you know, aged, as elderly. And we looked at middle-aged, but there were no entry terms aside from middle-aged. So, but that's okay. For now, we can add, let's say, middle-aged. We'll just do that. So we could put adults if we wanted to be a little more broad with this concept, but the chance that adults as a keyword would bring back maybe something outside the age range that we're looking for is possible. So that's a risk to take. I say risk, actually I don't mean risk. What I mean is it's just something to try. So searching in PubMed can be iterative. So let's say that we've got a fully fleshed out search with all of our concepts having mesh terms and keywords. We do the search and we find that we're not really finding what we want to see or anything relevant to the question that we have. You can always go back and say like, okay, I have middle-aged as a mesh term and a keyword. What happens if I add adults? Let's just see what happens. So that's always possible. So we'll go back to our question. Now we have our intervention to worry about. This is our other concept. So daily aspirin intake. Let's do aspirin in mesh database. Okay, so this is great. There's lots of different results that come up, but the first one looks the most relevant. So I'm going to click on this one. And according to the definition, right under this mesh heading, mesh term, this looks appropriate. I also have these subheadings though, which means that I can get even more specific with aspirin. Instead of just saying anything about this drug, I want included in the search. I want any article that has anything to do with this particular drug. I could get more specific. I could say only show me articles that have analysis of this drug, or analysis of the chemistry, or analysis of any poisoning that might have happened, which might also include adverse effects. So I can go through and kind of like tease out really specific concepts to do with aspirin if they apply to my question. But my question isn't about adverse effects. It's mostly about how it can help people, if it helps with cardiovascular situations among adults over 50. So I will quickly skim through these. Maybe therapeutic use. I could do that. I don't have to, but again, if I don't, and I just add this to Search Builder, and I put this, let's see, my second concept. I put this here, and again, let's say just like with middle age versus adult, or middle age and adults for just this concept, I do a search with everything fleshed out, and I find I'm not seeing really, I could maybe see better results than what I'm currently seeing. You can always go back here and say, look, I did aspirin, but what happens if I change that to aspirin and therapeutic use? What if I change that to both aspirin and therapeutic use? Or put an or here. So it's iterative, like I've said. So we have our mesh term for that. Now we have all these entry terms though, which is great. I will often copy the list. I will often copy the list to the page that I'm using to keep track of all of my mesh terms and keywords for a concept. And later on, I will clean these up. What I mean by that is, for instance, acetylsalicylic acid right here. Underneath that is acid, comma, acetylsalicylic. I don't know if I'm pronouncing that correctly. PubMed is, oh, someone, I hope I pronounced that correctly. But the acid, comma, acetylsalicylic, you know what I mean, this particular term, the comma does nothing. PubMed reads this backwards, forward, sideways, up and down. So you only need one version of it. You don't need anything with a comma. But you can always clean that up later once you've collected all of the kind of, you know, different keywords you might find for aspirin. Okay, so we had our question again. We've looked up, I put aspirin and Disperol, I put adults, but like I've been found together, middle-aged was better. There's no comparison to put in our search outcome. You know, maybe that's just part of the subheadings, the therapeutic effects. But we also have this heart attack aspect of it. So we go back to the mesh term database, and I always talk about it like heart attack. I don't really in conversation ever say cardiovascular event. But you could, if you are very professional and serious, put that in the mesh bar. I just put heart attack. But it brings up myocardial infarction. And if the definition is basically the same as what I typed in or what I'm thinking of, then great, we found a mesh term for it. Again, I can look at all of these subheadings. I see drug therapy. That might be great. I see prevention and control. That might be great too, because we're trying to find out if this aspirin prevents these sorts of events from happening. For the basicness of just this presentation, you can click both of them too if you like. You can add them both. But I'm just going to do myocardial infarction and keep it broad. Sometimes it's helpful to start more broad than narrow, and then kind of filter down to see what works just with every iteration. But it's totally up to you. You can do it a different way. If you want to start super specific, go for it. So I will put heart attack here. I got my mesh term that I like, that is appropriate. And now I need to look at my keywords. So we'll go back to the mesh database. Again, this is how I do it, mostly because I am a librarian. This is one of the limitations, or actually one of the great things about conducting a search with a librarian, is that we can find all of these terms, but the people that we're helping do this research with, mainly you guys, are the ones who have the medical knowledge to let us know that if this is appropriate or not. And you have even more terms kind of rattling around in your brains often, most of the time, things that I would never thought of. So, so this is what PubMed tells me, but perhaps there are even more that are talked about in the cardiovascular field that I would not know because I'm not medically trained in any way. So now that I have all of my, I think I've got my mesh terms and my keywords. I look these over, I think they look good, but there's more to be done. So we've got our mesh and our keywords, which is a really big part of the search, making sure that those fit appropriately. And then next, we want to make sure we're using this thing called nesting. And Boolean operators are in the correct, that we're using the correct Boolean operators in the correct places. The nesting makes sure that concepts, so the parts of your question, like middle-aged, aspirin, and heart attack, are kept separate from one another so that it's easy for PubMed to understand what you're talking about. If we don't use nesting, we end up with a ton more results because PubMed is thinking you want any articles with middle age, which is true, but you also want like any articles with aspirin and maybe one about teenagers as well as aspirin, which is not true. So it kind of goes all over the place, and the nesting helps keep things organized. It's also really a great tool to be able to see which parts of your search maybe need more fleshing out or changing. And so how I do this is I will take the mesh term, put it there, make sure my Boolean operator is or when I'm talking about the same idea. So middle-aged for the mesh and middle-aged for a keyword, I'm still talking about age here. So that just encompasses the age concept. For aspirin, I'll do the open parentheses. I'll just copy my mesh. I always put mesh at the beginning just to make sure that it's kind of like a flag to my eye when I'm skimming a search to make sure that everything is, you know, like this is the start of a new concept and maybe this one needs fixing. Pardon me while I format this. Okay, so between all of these, I won't go through all of it because I realize that would take a little bit of time. We don't have it. It's rather tedious to watch someone do that. But basically for a concept where you're talking about the same thing, you're talking about aspirin with your mesh, I would add aspirin as a keyword as well. You're just going to use the Boolean operator or, just or. Whenever I have all these concepts organized, like these all have, you know, there's or between the words and they're in the right format and everything, and there's closed parentheses, just like up here, I will then connect them with and. So I would have something like this middle-aged concept and our aspirin concept, etc., with our mesh term, and our heart attack concept. So and goes between all of the separate different ideas, or goes between all of the words that make up the different ways to talk about the same ideas. I hope that makes sense, but please let me know if it doesn't. I'm happy to explain further. Okay. So this is just another example. This is a shorter example and a prettier example because it's not quite so muddled with bullet points. But this is if we had our myocardial infarction or heart attack and aspirin put together using the correct. So or between all of the same, the words describing the same concept, and then and to connect a different idea entirely. Okay, so there's still more even yet to do. And this is also really, really important because when you have a quotation mark around a phrase or a dash, you're telling PubMed that you want these two words to be considered together. If you do not have the quotations around like myocardial infarction, quote, in quotations, or myocardial dash infarction, PubMed will read that phrase as two totally different things. So it'll say, okay, you want, for instance, if you had just myocardial infarction without any quotations or a dash in the middle of those two words, PubMed would say, okay, you want articles on myocardial. Gotcha. You want articles on infarction. Gotcha. Those two articles may be talking about myocardial infarction. They may not be. A better example might be heart attack. If there's no dash here and no quotations around the term or the phrase, it will bring back articles on heart. It might bring back articles on attack, which means you could get articles on heart attack, or you could get articles on dog attacks or dolphin attacks or heart transplants or anything to do with just these two words, but treated totally separately. And that's part of automatic term mapping as well. If you don't have this sort of indicator, it will search in all kinds of fields and as though these two things were separate. So you want to be specific and make sure that you're using quotations or dashes. I like to use dashes, and the reason I will get to in just a second. If it is one word like distal, there's no need to have it in quotations at all. If it's one word, it will just read it as one word in all sorts of fields, which is fine. So then we come to field tags and truncation. And truncation is why I like to use dashes between phrase words rather than quotations. I often sometimes find that quotations around phrases like myocardial infarction, if I'm using truncation, will mess up the results that I get or how this phrase is interpreted in PubMed. So what truncation is a way to tell PubMed, look, I do want myocardial infarction. I also want myocardial infarction. I want every variation of a suffix that could go with this root phrase to show up when I do my search. I also, with my field tag square bracket TIAB, what that tells PubMed is I want PubMed to search myocardial infarction and myocardial infarctions, or both of those, in the title and abstract of all of the articles you have access to, all the articles in the collection. I don't want it to search for the institution of myocardial infarctions and give me those results where they talk about spontaneous combustion in the 18th century. I don't want Dr. Myocardial Infarction to show up when he's talking about chewing gum and its benefits. I just want to search for myocardial infarction or myocardial infarctions in the title abstracts. So that way I know for relatively certain that they are talking about what I want to see, which is heart attacks, cardiac events, and nothing nonsense or just not what I'm looking for. Does that make, I'm just gonna check in really quickly just to make sure everybody's on the same page. Also give myself a chance to take a breath. Okay, I see a thumbs up, good job. Okay, cool. I'm glad I can hear it. Whew. Okay. All right, check chat. Nobody's done any chat. Okay. All right, in that case, I will keep on keeping on. So there are lots of different field tags, by the way. I talked about this this TIAB right here, but you could just do title, you could just do abstract. You could also use keyword, you could use author if you know there's a particular set of articles or article written by this one author. We also could search like affiliations, so organizations that these authors are associated with. And there's a whole chart, excuse me, there's a whole chart here at this link. So if ever you're kind of like, you want to use field tags, you're not sure which ones might be appropriate or which ones might be like best, you can check out the chart. I will say that the TIAB field tag is pretty great. It's the one I probably use the most often, unless I'm looking for something really super specific. Okay, so automatic term mapping I mentioned earlier. If it doesn't have a quotation or a dash, if it's a phrase, then it's using these tools for a phrase turns off the automatic term mapping. If it's a singular word that doesn't have like a field tag or anything like that, it's going to be automatically mapped by PubMed to a mesh term or other kind of field. And we can see that when I go search PubMed. This is another really cool function of PubMed. So underneath the search bar, you'll go to advanced. I like advanced because it's really easy to do like iterative searches here. So we have myocardial infarction or heart attack. TIAB. So I can add that to history. And you can see the difference in results when you try different things with your search. And that's just one concept, you know, that's just an example. We just added one thing, and it broadened the idea of what myocardial infarction is, how it's talked about in articles. So that means we got more results, which makes sense. But I really wanted to show you the automatic term mapping. So let's go to this one and just say heart. Yes, that makes sense. It lets you know when you mess up spelling too, which for me is quite often. Okay, so when you have a search and you look at the details, so you click on this little drop-down arrow, it has let me know that like, okay, it understands myocardial infarction as a mesh term. That's great. It also looked for myocardial infarction in all fields. Fine, but heart attack, heart, all fields, attack, all fields, versus heart and attack. Okay. So in this one, it connected them in all fields. And it also did that one. Okay. So anyway, it tries to take your, let's see, let's just trim it over. I always want to say myocardial infarction as well. So I didn't put mesh next to this term, but it tried to map it to a mesh term anyway. That's automatic term mapping. It's going to try to find the appropriate mesh term, which can be really helpful, but it can also be really problematic. I can't even give an example off the top of my head, but there have been times where it will map to something that is not quite what you want to find if you're doing the research. It also can make things a little fuzzy if you're doing like a systematic review or scoping review and you need your search to be really like systematic and reproducible. Automatic term mapping can sometimes be a problem. So if it affects reproducibility, I don't recommend relying on automatic term mapping. It's fine for simple searching. Like if you're doing just a basic search to see what's out there, that's totally fine. Okay, so we'll do one more all together. I hope people like the Schitt's Creek references. Okay, so the question, how does caffeine consumption affect cognitive performance? And again, healthy adults, no age group, so that's great. So we got to look at our sections of our question, our PICO. So we've got our population, what the problem is, the action we'll take. This is actually pair, but it would be population, intervention, comparison, and outcome. But this is pair, which is a different framework. Apologies for that, but it's the same concept of just making sure that all your ideas about your question or the parts of your question are covered. Okay, so turn it back. Sorry about that. So in this question, how does caffeine consumption affect cognitive performance? Population is healthy adults, pretty easy. Then we have our intervention, which is consuming caffeine. Comparison, I guess, not consuming caffeine. And the outcome we're looking at is, are they smarter? Are their brains working better? Let's find out. Well, I guess let's not find out. Let's just make a search for it. The finding out part is mostly you guys. Okay. So finding our mesh terms and keywords, I have gone ahead and found some mesh terms. So we did look for adults. That seems appropriate for this one, whereas the last question, middle-aged, was more appropriate. I have the keyword adult. It's great. For consuming caffeine, I looked up, I did look up consumption, or consuming, materials, food, drink, whatever. And it just was too broad, or it wasn't there. So caffeine was the next best thing, which is totally fine. It's relevant. We're consuming caffeine. We want to talk about caffeine specifically, not just consuming food materials. So I looked it up. There was ephedrine. That was, I think, one of the entry terms. There were several. You'll find that for like drugs or supplements or kind of like fluoride is one of them. You'll often see that there's supplementary concepts, or drugs often will have a ton of entry terms because they're called so many different things. You've got generic, you've got brands, you've got just so many different names, and that's pretty normal. So I just kind of briefly picked one. There were lots. And then our outcome for improved cognition, I looked up cognition. I also found drug effects on cognition, which may or may not be great. I might find that if I used drug effects and cognition, the mesh term in my search, that it would talk a lot about maybe prescription drugs. Maybe it would talk about the drugs that are not prescription drugs, drug abuse or substance abuse of some kind. So I could try it, but it's something to keep in mind. So next I made sure my Boolean operators were correct. So or between each word and mesh term that describes one idea, connecting them with and. I made sure my truncation and my field tags were what I wanted them to be. These can always change again. You can just do adult truncated so that it's like, I want adults and adults. I think maybe you might get an article in PubMed about adulting. That's a new word, but I don't know how often that occurs in medical articles. So maybe not, but it might come up. But if you wanted to, you don't have to put TIAB if you're fine looking absolutely everywhere for adults. But I know that I want to be really narrow with this particular thing because it's such a broad word. Cognition. I could have even put the truncation after cognate. So I would find like cognition, cognitive, maybe other variations of the word. And they're all nested, so that's great. And then this last little thing, I wanted to highlight, like, again, how iterative this process can and maybe sometimes should be. So if I replaced cognition, the mesh term, with cognition slash drug effects, that's okay. I don't want there to be the impression that, um, you know, you have to use, only one mesh, or you can use both. You could say cognition mesh or cognition slash drug effects mesh. You could use both in the same search. There's there's not a wrong, well, there is a wrong way. I guess there's a good way, there's a better way, and then there's a best way, and then maybe even a bestest way. That doesn't sound professional, but there are gradations to the searches depending on, and really the results are what tell you what the best way to search often is. Aside from what kind of project you're working on. So systematic reviews, it has to be reproducible. You have to have a reason for why you did certain things. But when you're just doing a basic search, even with a systematic review as well, your results kind of guide the way. If they're what you need to see to complete your research, you're on the right track. Okay, so we're coming towards the end of our session here. We have 15 minutes. If you want to do the survey, you can. It is certainly not required, but it helps me figure out what things I can improve on to make this more understandable, or what you would have preferred to have seen for this workshop, or if it was exactly what you were expecting. It's just it's 3 questions long. It's not long at all. But you are welcome to do it if you'd like. If not, that is also okay. I will not cry myself to sleep tonight. I will be all right. And there are more workshops coming up in the future. So we have a really basic PubMed searching one with EndNote. If you've ever tried to organize citations for a project, EndNote, I don't know how many of you have heard of it before, but it is wildly helpful. It's got a bit of a learning curve, but I've told people before that it's sort of like learning to ride a bike. You're riding a bike, it's going to be a pain to learn at first, maybe, but you're eventually going to end up getting places a lot faster than people who are just walking. We have just one on all the resources we have in Lister Hill, CINAHL, and there's tons more coming. I'm doing one on critical appraisal after my maternity leave, so not soon, but later. But you can keep an eye on that on our calendar and register for those if you are interested. And I will also go back to my contact slide in case anybody wants to reach out to me. And I wanted to also keep this time for questions in case anybody got lost or was confused at any point. Please let me know and I'm happy to talk. I'll just stay here and hang out for a bit. So if you need me, I'm here. If not, you're free to go too. I'm not trying to keep you hostage. Thank you very much. I appreciate it. Thank you. Oh, thank you. I appreciate that. Oh, good. I'm glad it helped. And if anybody needs, more help or a repetition of what I talked about, I would not be put out by that. You can schedule a consultation with me and I can repeat all of this or go over new things or answer questions. I'm happy to do that. Thank you so much. I appreciate that. Oh, thank you for coming. I will also see about sending out the recording of this to anyone who has registered, of course. So keep an eye out for that. Oh, thank you so much for that feedback. Oh, yes, I can. I can do that. One moment. Thanks. Thank you. Okay, so I will put that survey in the chat. I hope it works. Let me know please if it works. If not, I will figure something. Okay, perfect.